What gives me hope is just the amount of resilience and the amount of strength that kids have. I tell all of them, you have the internal resources, you have the internal strength to be able to deal with anything in life without having to have something outside of you to do that.
Hello and welcome to Mindshift, a PLCS Empowerment Collective podcast. My name is Christopher and I am one of your hosts, and unfortunately my co-host Deb is not available to join us today. So we're discussing a topic that I actually know very little, like an ignorantly little amount about, and that's vaping. And I'm going to go ahead and say that the reason I know so little about it is because I had such an effective DARE program when I was in elementary school, and they told me don't do drugs. And in my head, I said no drugs. So I don't know a lot about it, but we're going to learn about it today. I'm lucky to have an expert guest with us. So why don't you go ahead and introduce yourself?
Hey, thanks, Christopher. Really happy to be here. I'm Ken Zoucha. I worked as a general pediatrician in Hastings, Nebraska for about 20 years, and then was fortunate enough to be able to become involved with adolescents and working with them through a group home called Radius for juvenile justice involved youth, and have been fortunate to be able to learn from them. I'm working at Nebraska Medicine. I get a chance to train other medical students and house officers, or residents, we call them, in addiction medicine, which is kind of my main area right now, as well as an opportunity to continue to work with youth involved in juvenile justice. So I'm just really grateful for the opportunity to be here today.
Well, and it sounds like you have some great experience that's going to help bring the conversation home for our listeners. Again, this is my ignorance coming out, but I've heard like e-cigarettes or Juuls or vape pens and things like that. I don't know if they're all the same, but tell us what is vaping?
The term really for all of them is electronic nicotine delivery system, and or ENDS. And so Juul is a brand. E-cigarettes is one of the things that are terms that's used for those devices. And there's many varieties of those devices. Basically, what the device is a battery that's connected to a heating device. And then the heating device aerosolizes a fluid, and that aerosolized fluid then is seen kind of as a vapor cloud that gets inhaled into the lungs. And what causes the battery to connect to the heating device is inhaling on the device. And then once you aerosolize it, then it goes into your lungs. The difference between an electronic nicotine system or a vape and a cigarette really involves the kind of nicotine that's being used. So the nicotine in a cigarette is really kind of in an acid form. And so when it's inhaled, basically what a cigarette is combustion. You're burning the tobacco, and then the smoke from the tobacco is inhaled into your lungs. It has a caustic burning sensation in the back of the throat and down into the lungs, and is difficult to learn how to use. A vaping system uses a base salt of nicotine, which does not have the caustic sensation. And caustic just means burning, basically burning or uncomfortable sensation. So when you inhale from the vaping device, it's a cooling sensation into the throat and into the lungs. It makes it a lot easier to use and a lot easier to pull in more of the aerosol, hold it into your lungs longer, and subsequently more nicotine can get delivered that way.
So do you think because of the difference in the sensation when inhaling? Because I remember hearing when people started using these devices that they felt like they were less harmful than cigarettes or something like that. Do you think part of that is attributed to that sensation when you're inhaling?
I think that's part of it. Really, the main part is related to cancer associated with smoking tobacco. In our United States, almost 500,000 people die a year from nicotine-related disease processes. And it's mostly tobacco related. So it's cancer primarily, but also severe lung disease or heart disease as a result of smoking a nicotine product or using an oral nicotine product. The vaping does not use tobacco. And that's where a lot of the carcinogens come from, is the tobacco product. And so when they're vaping, there may be less carcinogens. The jury's out on that because we really need some more time to see what the level of carcinogens are, because the fluids have a lot of difficult fluids inside of them other than just nicotine. So there's like over 50 different kind of chemicals that can be inside the fluid. One of those that I was surprised was formaldehyde, or the embalming fluid. And so those are all harmful chemicals and have the potential to cause harmful effects to our body, including the potential for cancer.
Well, and one of the things that I also heard was that people also felt like or thought that it was potentially less addictive. So can you talk a little bit about use and addiction with these products?
The addictive product or chemical in that is nicotine. And so there are specific receptors in our brains where nicotine attaches to. And that leads to a pleasurable sensation. But the nicotine concentrations are high. And when we see these high levels of nicotine going in, the addiction potential is actually higher with vaping products than it is. I mean, it's high for both of them, but if it doesn't burn as much, if you can hold it in your lungs for a longer period of time, the more nicotine that's absorbed. So there's higher amounts of nicotine going in when people are vaping than if they're using a cigarette or any other kind of combustible tobacco product.
This is kind of a dumb question, but you said that nicotine hits pleasure receptors in the brain or whatnot, and so it creates a positive effect or a positive feeling that the person has. But what are the dangers of using nicotine products?
When we think about that, we think about, like, if this is not tobacco and it's not causing cancer, then what is the risk? So the risks that we know of are that people do develop tolerance to nicotine. They need more and more to get the same effect. They have withdrawal if they have to stop using the nicotine that doesn't feel very good. A third of kids who start using nicotine through vapes end up eventually moving over to combustible products. So they're using cancer-causing agents, and that's way higher than kids who never vape at all. There's the harmful chemicals that we talked about in the fluid other than nicotine. And then our studies show that if kids start using nicotine under 16 years of age, is that they're much more likely to develop substance use concerns with other things like alcohol or cannabis or other types of substances that people can have an addiction to or develop a substance use disorder with. So those are really the dangers that are associated with that.
You mentioned that kids at, I think you said under 16 that begin using it are more likely to use other products beyond that. What do you see in the research as far as what age are kids exposed to these products now?
In 2024, a survey called Monitoring the Future, it's done every year, it's a national survey, is that about 10% of 8th graders have used nicotine in the last 30 days. So that's a pretty high kind of number. And it doesn't mean that they go on to continue to use them after that. But we also know that the younger somebody starts, the more likely they are to develop an addiction to that substance. So in my clinic work that I do, it's not unusual to hear about kids starting at 12, 13 years of age, which is right around the 8th grade age range.
Well, and that you said this is self-reported information. Is that
It is.
right? And so 1 out of 10 kids in 8th grade self-reported that they used a nicotine product in the last 30 days. That seems like a high number to me.
When we look at somebody who has gone from trying it once to using it on a continuous basis, that number does go down. And so in Nebraska, for instance, when we look at high school kids, it's about 7% who are using nicotine on a regular basis. And so 1 out of 10 is high. It's higher than what we would like to see it for sure. But I feel that there's also headway being made because those numbers are lower than they were 3 years ago, 4 years ago, and they're definitely lower than they were 10 years ago. And so, while 10% is probably still too many, things are changing. Things are getting better from that standpoint.
So for parents that are listening who may be feeling a little bit of anxiety right now, hearing some of these statistics and thinking about and wondering about if their middle school, high school kids have tried it or have used it before, do you have any advice for them? Should they ask their kid about it? Should they talk about it?
100% talk about it and having open conversations. Peer pressure stuff is pretty high for kids. I think one of the things to think about is that if it's 1 out of 10 that have tried it, that means 9 out of 10 have not. And I think bringing information to the table for kids and asking, do you have any friends or have you seen any of your friends vaping? And have you tried vaping? With the understanding that we're not there to punish them for trying that, but there to listen to them and understand why they might have tried it and how that felt.
And if somebody listening right now wants to have that conversation with their kid and they really just don't know where to start, or maybe they think that their kid is using a nicotine product and they don't know how to approach the situation, are there any resources that you know of or organizations that have websites with helpful resources that we might be able to direct them to help them with those conversations?
Thank you for bringing that up because we get a lot of information off of the internet, and in having good places to go, I think, is really important. The American Academy of Pediatrics is probably one of the most reputable sources and where I go for so much of my information surrounding that. And so there are lots of resources about how to have conversations with kids, how to maybe have a contract with a child, where to go if you're concerned that your child might be using nicotine or might be having difficulties with having a use disorder. One of the statistics that I thought was really interesting just for Nebraska is that of the kids that were vaping, over 60% of them have tried to stop and couldn't or wanted to stop. And so when your body is having these neurotransmitters stimulated to such a high degree, your body adapts to that. And it changes just the normal way your brain works. So that's what so much of our therapy is about, is how do we help you continue to walk forward, continue to do the next right thing or take that next step despite how you feel, and walking kids through that. And there's several actually good like websites and apps for phones that looks at helping kids stop using nicotine. So one of those is called the Truth Initiative, and there's another one called smokefree.gov. And what they are is they show young people who are also want to stop or are in the process of stopping nicotine and the coping skills that they use and how they manage the uncomfortable feelings and what they do when they really, really want to vape again. The other thing I would encourage parents to consider is if they are concerned about their child maybe having difficulties with nicotine use or vaping use, is just to access your pediatrician or your family medicine doctor, your primary care doctor, because they have resources and they have the ability to get you to places that can help if they are unable to do that.
As we're coming to the end of our time together, you mentioned that making one step forward or one step in the right direction, thinking about how to wrap this up in a positive way, we always like to ask about hope. So what gives you hope about supporting young people through these experiences or managing this substance use?
I help kids get through that, and what gives me hope is just the amount of resilience and the amount of strength that kids have. I tell all of them, you have the internal resources, you have the internal strength to be able to deal with anything in life without having to have something outside of you to do that. It's there. It's just been blocked, and once you find it, once you figure out what that is, and it oftentimes takes help from others to do that, you will be unstoppable. And you'll be able to do anything you want to do from this point forward. I've seen that in kids over and over and over again.
I think that's some solid advice, and I have loved our conversation today. Thank you so much
Same.
for your time. And thank you, listener, for listening to Mindshift. As a reminder, we do have resources available on our website at plcschools.org/Mindshift. So I'll be putting all of the resources that Dr. Zoucha mentioned on that page. And if you enjoyed today's podcast, make sure you follow us wherever you get your podcast. And we'll see you next week.